welcome back guys. Now in this video, let's discuss about the baroreceptor reflex, something related to the blood pressure. First we will discuss what is a normal blood pressure and later we will be discussing about the baroreceptor reflex, how it is trying to maintain the blood pressure. See, everyone knows that our BP, our blood pressure, that is a systolic by diastolic blood pressure is 120 by 80. Every student knows this. Okay. During systole, how much blood pressure will be there? Then it's 120 mm of Hg blood pressure, and during diastole, there is 80 mm of Hg pressure is there in our blood vessels. That two major blood vessels. And what is the difference between these two pressures? The difference between the systolic and diastolic blood pressure is called as a pulse pressure. PP stands for pulse pressure, that is systolic minus diastolic blood pressure. How much is that? That is 120 minus 80. 120 minus 80 is how much? That's going to be 40. So pulse pressure is the difference between systolic and diastolic blood pressure. Okay, systolic minus diastolic blood pressure. Then what is a MAP? MAP stands for what? MAP stands for the mean arterial pressure. Okay, now mean arterial pressure means what? Mean means average. The average arterial pressure. How much is the amount of blood pressure that is averagely maintained in our arteries? Okay, so it's not during systole, it's not during the diastole. How much is the average BP? The average BP, to calculate this, there is a formula called as the diastolic blood pressure plus 1/3 of the pulse pressure. Okay, diastolic blood pressure plus 1/3 of pulse pressure. How much is that? You know, diastolic blood pressure is how much? 80. And 1/3 of the pulse pressure. Pulse pressure is 40 divided by 1/3, that is 40 divided by 3. How much is that? 13. So 80 plus 13. 80 plus 13, how much? 93. So this is the average BP maintained in our body. Okay, this is the average BP maintained in our body. That's the mean arterial pressure. There is one more formula to calculate this mean arterial pressure. 2/3 of 1/3 of systolic blood pressure plus the 2/3 of diastolic blood pressure. There is one more formula for that, but we are not concerned about that right now. So I'm telling you, the average BP in our body is called as the mean arterial pressure, and how much is the value of the mean arterial pressure? It's 93. That's it. Okay. Now let's discuss about the baroreceptor reflex. Where are the baroreceptors located, guys? Baroreceptors. See, what are baroreceptors? Baroreceptors are always checking about the mean arterial pressure, whether the mean arterial pressure is normal or not, maintained or not. Okay. So is everything okay in the body or not? They are always checking the mean arterial pressure. Okay. They are sensitive to the mean arterial pressure changes. So the baroreceptors, where are they present? They are present in the carotid sinus and aortic arches. Okay, these baroreceptors continuously 24/7, they are checking about the BP, mean arterial pressure, normal or not. And what is the location of these baroreceptors? The baroreceptors are located in the aortic arch as well as the carotid sinus, in these two areas. And what they are doing? By sitting in this area, they are continuously monitoring the mean arterial pressure. Okay, question is, they are present in which layer? They are present in which layer of the blood vessels? You know that blood vessel is made up of tunica, intima, media and adventitia. 3 layers are there. These baroreceptors are present in the blood vessels. Of course, carotid sinus is a blood vessel, aortic arch is a blood vessel. They are present in which layer of the blood vessels? In the tunica intima, media or adventitia? In the tunica adventitia, the superficial layer. So these baroreceptors are located in the tunica adventitia. Again, they are not located deep inside the blood vessels. They are present superficially on the top, tunica adventitia. Okay. Now, from here, they have to give the information to, okay, they are sitting over here and they have to give the information about the mean arterial pressure to the central nervous system. They have to inform to the central nervous system that this is the mean arterial pressure in the body. So for that, these sensory nerves are helping. So what are these sensory nerves? These are nothing but the branches of the 9th and 10th cranial nerves. See, the 9th cranial nerve and 10th cranial nerve branches, that's the glossopharyngeal nerve and vagus nerve branches, called as the Herring's nerve and Sands nerve. Herring's nerve is a branch of the 9th cranial nerve and Sands nerve is a branch of the 10th cranial nerve. So these neurons, now they are acting like afferents. Acting like afferents means they will take the information where? From the carotid sinus and aortic arch, the information is going to the central nervous system. Okay, which part of the central nervous system? Is it the brain receiving the information? No, it's the medulla. So medulla is receiving the information about the BP, the mean arterial pressure in your body, is it normal or not? Which part of the medulla specifically? Is the nucleus of tractus solitarius. The nucleus of tractus solitarius is receiving the information about the BP, normal or not, normal or not. Now this nucleus of tractus solitarius will do accordingly what I have to do. Okay, it will decide whether we have to increase the mean arterial pressure or whether we have to decrease the mean arterial pressure. It's under the control of the nucleus of tractus solitarius. Okay, now let me give you an example so that you will have a better understanding. Okay, so before going there, you tell me where are the receptors located? Baroreceptors. Baroreceptors, where are they located? Carotid sinus, aortic arch. And what are the afferents in this pathway? In this reflex, the afferents are 9th and 10th cranial nerve, that's the Herring's nerve and sinus nerve. What is the center in this reflex? The center is the medulla. Which nucleus of the medulla? It's the nucleus of tractus solitarius. Where are baroreceptors located? Tunica adventitia. Baroreceptors are sensitive to what? The mean arterial pressure changes. Okay. Now let's say today there is increase in BP. Your BP is increased. Okay, you are having some fight with your girlfriend and your BP is increasing. So tell me, is it good for your No, definitely it's not good for you. When your BP increases, definitely there is a chance that your blood vessels will rupture. It's not good for you as well as your relationship. Okay, increase in BP, like shouting at her, it's not definitely good for you. Okay, so whenever your BP increases, which receptors are activated? The BP increase in BP is going to cause the activation of the baroreceptors, or the distension of the baroreceptors. Now the blood vessels are getting stretched. Okay, because of the BP, the blood vessels are getting stretched. That stretch is going to cause the distension or activation of these baroreceptors. Now these baroreceptors, now they will give the information to 9th and 10th cranial nerve. Okay, now they are going to give this electrical information of the action potentials to the 9th and 10th cranial nerves. Now the 9th and 10th cranial nerves are carrying more and more action potentials. Now the information, where it will go? The information is going to the nucleus of tractus solitarius. Now the nucleus of tractus solitarius is the headquarters. Now it will understand, oh, there is more BP in the body, there is more BP, which is definitely not good to him. So immediately this nucleus of tractus solitarius, it's having two hands. See, nucleus of tractus solitarius, it is doing two things. It is doing two things. What is that? The nucleus of tractus solitarius is going to release glutamate, excitatory neurotransmitter glutamate, onto the CVLM, caudal ventrolateral medulla. Now this caudal ventrolateral medulla area is activated. Now it is going to release GABA. Which neurotransmitter is getting released? GABA. GABA onto the RVLM, rostral ventrolateral medulla. Okay. So first it is the CVLM which is activated. CVLM is going to release the inhibitory neurotransmitter called the GABA. Now GABA, what it will do? GABA is going to inhibit the RVLM. And you know what is RVLM? RVLM is the sympathetic headquarters. RVLM is the one responsible for the sympathetic activity in the body. So entire RVLM, that is a rostral ventrolateral medulla, is inhibited. So now, do you think sympathetic activity in the body works? No. Immediately, see, the sympathetic activity goes down, sympathetic activity decreases. And whenever the sympathetic activity decreases, what do you think will happen to the heart rate? Decreases. What do you think will happen to the BP? Decreases. BP also controlled. So, how to control your BP? How your BP is getting normalized? Coming back to normal by decreasing the heart rate. When your heart rate decreases, stroke volume decreases, the cardiac output decreases, everything decreases. Okay, your BP also decreases within some time. So, this is a nucleus of tractus solitarius. What it is doing? With one hand, it is shutting down the sympathetic activity. With the other hand, it is activating the parasympathetic activity. The vagus is nothing but the parasympathetic cranial nerve. So, there is going to be more vagal activation. And what the vagus will do? Vagus is going to decrease the heart rate again. So, same result. So, this is a nucleus of tractus solitarius. Okay, NTS, with one hand it is shutting down the sympathetic activity, it's turning on the parasympathetic activity. So heart rate decreases, BP decreases. So tell me, the BP is bringing back to normal. We are controlling the BP, bringing back to normal. Okay, so tell me, if you are bringing it back to normal, trying to maintain the normal range, so definitely it's an example of what? It's an example of negative feedback reflex. Okay, so baroreceptors are always trying to decrease your heart rate and decrease the BP, coming back to normal. So always remember, very important point. This baroreceptor reflex is an example of negative feedback reflex. Okay, it's an example of what? Negative feedback reflex. So, what is Mary's law? Now I will be explaining you about the Mary's law. So, what is Mary's law? Mary's law will tell you, whenever your BP increases, okay, whenever your BP increases, after some time immediately your heart rate will come down. Your heart rate decreases. So, increase in BP is going to cause a reflex decrease in the heart rate. Okay, first, whenever BP increases, your heart rate will come down. Whenever your heart rate comes down, automatically after some time your BP will also become normalized. So this is called as the Mary's law. Mary's law, increase in BP, pathological increase in BP is going to cause the reflex decrease in the heart rate. That's Mary's law. Okay. Now here I want to give you some golden points, golden rules. What are those golden rules, sir? See, important points. Look at them. Whenever your baroreceptors are activated, baroreceptor activation, doesn't matter what is the condition. I am not talking about the condition. Okay, of course, whenever your BP increases, baroreceptors are activated. I am not talking about the stimulus. I am talking about whenever your baroreceptors are activated. What will happen? Baroreceptor activation. So, sympathetic nervous system is going to be inhibited. And what will happen to your heart rate? Your heart rate comes down. This is the golden rule. Whenever your baroreceptors are activated, sympathetic nervous system is inhibited, your heart rate comes down. Okay, later your BP comes down. In the opposite, whenever your baroreceptors are inhibited, what do you think will happen? So, baroreceptor inhibited means your sympathetic nervous system is activated. And what will happen to your heart rate? Your heart rate increases, your BP increases. Okay, so this is the golden rule. How the baroreceptors, how they are related with the heart rate. Baroreceptor activation, heart rate decreases, negative feedback. Baroreceptor inhibition, sympathetic activation, and heart rate increases. Okay, why this is important for you? I will explain you. So, first look at this condition. So, now let me give you an example. Guys, look at this diagram or image where we are showing that the carotid sinus in this area, okay, the carotid sinus in this area is getting compressed, or we are doing the massage, sir, let's say. The massage is a better word. So when you are performing the carotid sinus massage, okay, you tell me who is going to be activated, sir? In the carotid sinus, baroreceptors are there. Whenever you are doing like this, the carotid sinus is getting distended, or like the baroreceptors in the carotid sinus area is getting distended and they will be activated. So carotid sinus massage is going to activate the carotid baroreceptors, and you know the story. Whenever the baroreceptors are activated, what will happen? Immediately the heart rate will come down. So that is the reason why whenever you perform the carotid sinus massage, okay, you have to do only on the one side. You should never do bilaterally. You should only do on the one side. The two carefully. The patient shouldn't be having any atherosclerosis of the carotid arteries. So whenever you are performing the carotid sinus massage, which will be activated, the baroreceptors will be activated. Whenever the baroreceptors are activated, you know the story. What will happen to the heart rate? Immediately heart rate decreases. So that's why carotid sinus massage is going to decrease the heart rate immediately. Heart rate decreases, BP decreases. So whenever you are having a patient with a severe hypertension and severe tachycardia, so to decrease that heart rate, what we can do? We can do the carotid sinus massage. Within few seconds, the heart rate will come down. Okay. Now, let's see what happens if you are doing the clamping. Clamping above the carotid sinus and clamping below the carotid sinus, okay, will cause. So what is the final result? How to understand this? Look at here. Students, internal carotid, external carotid artery. Down here is a carotid sinus. Here is a common carotid artery, we know. So common carotid, carotid sinus, internal carotid and external carotids. Now let me duplicate this. Two conditions we will discuss now. Okay. Now in the condition number 1, I am clamping above the carotid sinus. Let's say I am keeping a clamp over here. So tell me what will happen. When I am keeping a clamp over here, means that area is blocked. Now do you think the blood can go up? Do you think the blood can go into the internal and external carotids? No, it's not going to be possible. So now the blood is going to accumulate over here. Okay. Now in this area the blood is getting accumulated. Now that is going to activate the baroreceptors. The accumulation of the blood is going to increase the BP in this area. So whenever you are creating a block here, there is going to be more pressure that's going to activate the baroreceptors. Now you tell me, whenever these baroreceptors are activated, now what they will do? This baroreceptor activation is always going to decrease the heart rate. So clamping above the carotid sinus, decreases the heart rate because the baroreceptors are activated. Now what if you are clamping below the carotid sinus? Okay, clamping below the carotid sinus. When you clamp below the carotid sinus, no blood is coming here. The blood is not coming here. So what will happen to the BP? Your BP decreases in this area. So whenever your BP decreases, what will happen to the baroreceptors? Baroreceptors are inactivated. So now the baroreceptors are getting inactivated whenever BP decreases. So now what will happen? You know the logic. Whenever the baroreceptors are inhibited, what will happen? The sympathetic nervous system is activated and what will happen to the heart rate? Increases. So exactly opposite. Clamping above decrease the heart rate. Clamping below increase the heart rate. Okay. So these are the MCQs that you can expect in your exams. Clamping above the carotid sinus will decrease the heart rate and clamping below the carotid sinus will increase the heart rate. Okay. Next, what else you should know? Guys, you should know about what are tube herring waves. Okay, what are these tube herring waves? Students, listen carefully. Here is your heart. Imagine this is the heart. Okay. Now I am talking about during inspiration. During inspiration, what will happen? I have taught you there is going to be more venous return. More venous blood is going towards the heart. Okay, because of the negative intrathoracic pressure. Whenever we do inspiration, more blood is going to the heart. All the venous blood is coming to the right side of the heart. So now you tell me what will happen. Whenever this more venous blood is coming to the heart is going to get filled. The right side of the heart is going to get filled. Okay, the right side of the heart is getting filled. So this is what is going to happen. See, now this venous blood, which is coming into the right ventricle, it is actually displacing the interventricular septum. It is actually displacing the interventricular septum towards the left side. So because of which, what happened? The left ventricular volume decreases. LV cavity size, the LV cavity size decreases. The end diastolic volume decreases. And what will happen to the stroke volume decreases, and immediately your BP will decrease, your blood pressure will decrease because the less blood is being pumped into the blood vessels. So if the less blood is being pumped into the blood vessels, automatically the blood pressure will be less. Okay. So now what I am trying to say, during inspiration, during the time of inspiration, what is happening? So during inspiration, more venous return to the heart. So more ventricular filling, more right ventricular filling, which is going to cause the displacement of the interventricular septum. So during inspiration, always remember, during inspiration, your BP actually decreases. And during expiration, what will happen, sir? Exactly opposite. During expiration, your BP will increase. Okay, remember that. So your BP is not going to be constant, especially I am talking about the mean arterial pressure, the average BP. So it's not going to be constant. Don't think that your mean arterial pressure is always at 93. Okay, kept on fluctuating with every inspiration and expiration. With every inspiration and expiration, your BP can change. The pressure in your blood vessels will change according to the inspiration and expiration. So inspiration, during the time of inspiration, your BP slightly decreases, and during expiration increases, slightly decreases, increases, slightly decreases, increases. The mean arterial pressure is kept on fluctuating. So these fluctuations in the BP, with inspiration and expiration, they are called as what? True-bearing waves. So the true-bearing waves are the fluctuations in the BP with position, no, with respiration. So right, true-bearing waves are fluctuations in BP, the fluctuations in BP with respiration. With respiration, your BP will change. So they are called as the true-bearing waves. Next, what else you should know in this topic is the change in the BP with the position. Not only with respiration, your BP will change with your position. The way your body is aligned can actually change your BP, can change your heart rate. How? Let me tell you with one classical example, which will again come in your medicine and pharmacology also. See, when you go from supine to standing position, means suddenly you are going from a lying down position like this from the bed, suddenly you are standing in the night. Okay, you want to go for like some toilet, you from the lying down position, suddenly you woke up and you are standing like this. What will happen? Same, because of this standing position, because of the gravity, the blood will pull down almost like 500 ml of blood. Okay, around 500 ml of blood is going to pull down into the lower limbs. So yes, there is pooling of the blood in the lower part of the body, almost 500 ml, half a liter. So because of which, what happened to the blood coming towards the heart? The venous return, the blood which was supposed to come towards the heart, it's decreased. So there is venous return decreases, stroke volume decreases, cardiac output decreases, everything decreases because the less blood is coming to the heart. So automatically the cardiac output decreases, BP decreases. So now there is decrease in BP. Now I have taught you, whenever your BP increases, the baroreceptors are activated. Whenever your BP decreases, the baroreceptors are actually inhibited. So negative symbol means inhibition of baroreceptors. So today what happened? Immediately your baroreceptors in your body are inhibited. So I have taught you, whenever the baroreceptors are inhibited, what happened to the sympathetic activity? The sympathetic activity in your body will increase. Okay, so the vasomotor center is activated, the sympathetic activity in the body increases. Now you know the result. Whenever the sympathetic activity increases, what will happen to your heart rate? Your heart rate increases. Your heart will contract with more power. So there is increased contractility, there is increased inotropy, there is increased chronotropy, because of which the stroke volume increases. Okay, whenever the sympathetic nervous system is activated, epinephrine is released, so that your blood vessels will undergo vasoconstriction. Okay, so because of all these events, you tell me what is the end result? The end result is increase in BP. Increase in BP in the sense what? Bringing the BP back to normal. Okay, so here this is the problem, no? So when you suddenly woke up, when you suddenly stand like this, your BP will fall for a transient amount of time, for let's say for a few seconds, let's say your BP will decrease. Immediately the baroreceptors are inhibited, the sympathetic nervous system is activated, the blood vessels will constrict, the heart will beat more number of times with more power, so trying to bring back the BP to normal. So whenever your BP is decreasing, okay, so immediately your BP will be brought back, to normal. So what is happening? So this is what they will ask in your exam. When you suddenly go from lying down position to standing position, what happened to the baroreceptors? Are they activated or inhibited? The baroreceptors are inhibited. Actually the venous return, the venous return decreases, the cardiac output decreases, the stroke volume decreases, there is peripheral pooling of the blood, so baroreceptors are inhibited. The inhibition of the baroreceptors, you know the answer. Whenever the baroreceptors are inhibited, the sympathetic activity increases and BP increases back to normal. Okay, BP increases back to normal. With a change in the position, the BP can actually change. Okay, so with this, we have completed the topic of the baroreceptor reflex. Now, again, I am telling you what are the important things that you should know in the baroreceptor reflex. The baroreceptors are present where? The baroreceptors are present in the carotid sinus, aortic arch. And what is the center? It's the nucleus of tractus solitarius in the medulla. And what are the afferents? 9th and 10th cranial nerve. Baroreceptor reflex is an example of a negative feedback reflex. What is the mean arterial pressure? The mean arterial pressure, the formula is diastolic blood pressure plus 1/3 of the pulse pressure, that is somewhere around 93. Baroreceptors are always located in the tunica adventitia. When with your respiration, the BP can fluctuate. Those fluctuations are called as the true-bearing waves, and with the position also your BP can fluctuate because of either activation or inhibition of the baroreceptors. Okay, so with this, the topic is completed. Hope the video is helpful. Thank you.